Dennis, thank you for your ongoing support of our program and for how beautifully you communicate our work. Jim, thank you for taking the time to come and welcome our guests. You and other Mount Sinai trustees have supported us in so many ways, as has the Mount Sinai Auxiliary Board, administration, faculty, and staff. I would like to congratulate and thank each honoree and each co-chair. You all did such a fabulous job to make this event successful. To all of you here today, thank you for getting up so early to come help us celebrate our wonderful honorees. Thank you for your generosity. We could not do our work without you, without your tremendous support. The powerful stories you will hear from today's young people clearly demonstrate the impact of your gifts. There are donation cards on your table that you can give to the volunteers as you leave, or if you prefer to donate online, you can use your phone to the QR code that are on your table. We can provide a full year of comprehensive services to a young person for just $1,000. Every dollar makes a difference. I would like to thank the staff from the Mandarin who have been here since very early today. Let's give them a round of applause. Thank you. We have here a few people who ran the New York City Marathon to fundraise for us. Thank you and congratulations for such an amazing achievement. Please stand to be recognized. The runners. Any person interested in running a full marathon or a half marathon, just let us know. We are already putting the team for the next year. To all our staff and trainees, thank you for loving our kids, our patients the way you do. Your great care helps them heal and succeed. You are all doing this. You continue to do this work despite the impact that the COVID-19 pandemic has had on you and your families. Can all past and current staff, trainees, volunteers, and patients please stand to be recognized? I would like to say a word about Dr. Ann Nuchisak. Ann, get up. Just stand up. And just step down after 20 years of being our medical director. 20 years. She did a fabulous job. And she was the person that during the pandemic decided to keep the clinic open Monday through Saturday. And at the same time, she needed to make sure all the staff and all the patients remained safe. So Anne is staying with us as a clinician, and she's a master clinician. Thank you. Now I would like to introduce to you our new medical director, Dr. Wendy Neal. Wendy. Wendy previously worked with us for over 10 years as a physician, and we are fortunate that she agreed to return to be our new medical director. Wendy is amazing, and we are lucky to have her. And I want to thank the two of you for your leadership and really the hard work that you do. I know it's not easy. Thank you. Now I would like to tell you a little bit about the Mount Sinai Adolescent Health Center. For those of you who may not know us, we have a comprehensive youth-friendly health and social services system of care accredited by the federal government at the highest level as a medical home for young people. We have 38,000 patients ages 10 to 26 in our patient roster and serve 12,000 every year. Our mission is to break down racial, social, economic barriers to health care, health and well-being for young people by providing vital services, high quality, comprehensive, integrated, confidential, and at no cost to them for all who come to us. We pay for all their services, all the laboratory tests, all their medication, and we give them Metro cards for transportation. Not a penny ever exchanges hands with a patient. We aspire to be a program without barriers. We provide these services to promote equity and within the frameworks of racial, economic, social, and sexual and reproductive justice. In addition to our program on East 94th Street between 1st and 2nd, we also have full-time clinics inside 6 high school buildings, serving 23 high schools and middle schools. Now I want to share with you a little bit about the impact the pandemic had on our patients. At the height of the pandemic, in May 2020, we instituted a monthly survey to assess the impact of the pandemic on our patients. We found out 1/3 of the patients were clinically depressed. This represented a 20% increase compared to before the pandemic. A staggering 33% of the patients reported they had lost a loved one. 33% of our kids. We must remember that at the peak of the pandemic, people who got sick with COVID basically disappeared into the hospital. The family was not able to visit, and if the person was dying, the family could not be there to say goodbye and could not get together to mourn the death. All the rituals were gone. This was very traumatic for everyone, especially to young people who did not have the life experience to put this in context and to process what was going on. The trifecta of the pandemic, the financial crisis, and the racial reckoning, in addition to the staying in place mandate, the closing of schools, the interruptions of prom and graduation, has contributed to higher levels of depression, anxiety, and interpersonal violence in our young people. This has led to higher demand for mental health services. We are getting 50 calls per week asking for mental health. This is double the pre-pandemic rate, and it is hard to find enough staff to meet this need. We are struggling with this. So any person who's able to come and help us provide services or help us find mental health people, social workers, psychiatrists, please, that would be much appreciated. But despite the fact that our patients have a history of trauma, they were disproportionately affected by the pandemic, and they come from disinvested neighborhoods, they have great outcomes. Most of our patients graduate high school, many attend college, and some go to graduate school. Our patients have very high immunization rates and lower pregnancy rates, just to mention a few. Without our program, the majority of these young people would go without those services they so desperately need, and their outcome will not be as good as they are. We do not see adolescence as a period of problems to be solved. We see adolescence as a time of opportunity where the appropriate intervention at the right moment can have huge payoff. The Mount Sinai Adolescent Health Center is an oasis in the middle of New York City, and it has become a beacon of hope for adolescent health around the globe. Each of you make this happen. Thank you for helping us give a young person a place of healing and a place of hope. Thank you. I would like to thank our two youth speakers, Jean and Melissa, and this year's youth MC, Mosa Mariam Mendez, for sharing their stories with us. We could not ask for a more impressive group of young people. Thank you for allowing us into your lives. And thank you for sharing your journey with us this morning. Mose.